Let's go live now to Greens Victorian Senator Richard Di Natale in Melbourne.
Abbott government's seen sense on this, and the decision by the Health Minister is certainly welcomed by the Greens, and I think it's welcomed by the community more generally. This is a good outcome. It's also important to acknowledge that the only reason we've seen this decision is not because the government's had some road to Damascus conversion, but because they didn't have the numbers in the Senate. We need to be honest and frank about that, and I'm really pleased that the Labor Party and the crossbenchers backed my motion to disallow these changes in the Senate. This is a good decision, and it shows the Senate is doing its job. You have to wonder about how we've actually got to this point. You have to wonder about the fact that we were promised this sort of calm, methodical, grown-up government, and yet when it comes to healthcare policy, it's one shambles followed by another shambles. It's just chaos. This is now version 3, I think. We had version 1, which was a $7 co-payment. We then had the announcement for a $5 payment and the announcement on reducing the rebate for short consults. Then we heard that there were problems with that and they had to make changes during the Christmas period for vocationally registered and non-vocationally registered doctors. It's just been a shambles. It's been chaos, and it's the opposite to what we were promised. I know the Minister said that she had some feedback from her backbenchers who said they'd been out in the real world and they were giving her very clear feedback that this wasn't popular. Well, it makes you wonder, what world is Tony Abbott and the former Health Minister living in? This was obvious from the moment it was introduced that it was bad policy, it wouldn't achieve any savings in healthcare, it would just force patients to pay more and do nothing to improve the quality of general practice. I'll just wait for... Could be an ambulance coming to rescue Tony Abbott's health policy. But what we've got is a situation where the Abbott government now needs to press reset on health policy. I'm pleased that the Minister has said today that she wants to consult. That's a good thing. That is a good thing. We need to consult. But why has it taken 6 months for the government to come to this realisation that to develop good policy you need to consult? And I've been consulting now for over a year as the Deputy Chair of the Senate Select Committee on Health, the Chair of the Committee into the Commission of Audit and the Abbott budget cuts. We've been hearing from health professionals, from groups like the AMA, from consumer groups, from community groups, from policymakers across the spectrum who have given us some very concrete, very positive for reforms that would improve the long-term sustainability of the health system and make it fairer, make it a system that more people can access rather than less. I can tell you, as a doctor who's worked in general practice, somebody who's worked in public health, you don't make the health system more sustainable by forcing patients to pay more. That's not the way you do it. That's just a recipe for a US-style health system. Much more expensive for the taxpayer and a much less fair health system overall. So the commitment to consult is welcome. It comes far too late, but at least it's come. Now, the first thing the Minister must do, if she's genuinely committed, if she is genuinely committed to consulting, is to rule out the other changes that were introduced as part of this package. So this wasn't just an announcement to reduce the rebate for short consults. There were 2 other very important initiatives that the former Health Minister introduced. That was to introduce a $5 co-payment for patients, and the second was to freeze Medicare payments for doctors. Well, both of those things must now also be taken off the table. And I call on the new Health Minister to say, if you are genuinely committed to consultation, then you will today reverse the proposal for a $5 co-payment and reverse the freeze for doctor payments, because all that does is mean that patients pay more. That if you are genuinely committed to consultation, that's what you will do. She said today she doesn't want to embark on sham consultation, that she had no grand plan because she was openly consulting with the community.
Now, if you'd like to hear more of Richard Di Natale, just go to Multiview, press red on your remote.